Hello, everyone, and welcome back to the Grateful Not Greedy podcast. My name is Kris, and I am here with my very naturally beautiful co-host, and her name is
Rachel, hi.
Hello, Rachel. Are you laughing already?
Yeah. I'm like I'm sitting here and you always look so put together and I'm literally hair thrown up, no makeup on, I'm like,
I
oh,
can promise you, I don't look put together, and the story I'm going to tell you, you're going to realize why I don't look put together. So here's my
oh,
story
which
of the
is
day.
which is interesting because from the outside, from here,
You
you
think
look
I look
really
put together?
yeah,
Yeah,
you look
okay, we'll
really put
pixel in.
together.
We'll pixel in a little later, you'll see. So my story is is today's Saturday or Sunday? I don't know. Today's the weekend. Okay. And 1 week ago, I had some plastic surgery. I went under the knife, as so to speak. I made a choice to get some stuff done. And I am a lady of a certain age, as everyone probably knows. And I thought, you know, I've been in this recovery. It's so complicated because yes, I went under the knife. Yes, I had very specific reasons to do that. But even if I didn't, I don't owe anyone any reason, for the choices that I'm making, right? Um, but as I was going through this week and going through the recovery, and again, I'm a nurse, everyone knows this, it's not a surprise. So I understand recovery and I understand how that whole process works. And there's this whole kind of like roller coaster that you go through when you have like a procedure. So I thought, I'd really like to digest this with you today because there are so many issues that come up when you are a plastic surgery patient and when you're even considering being a plastic surgery patient or when you're looking at people in magazines or the Kris Jenners of the world or whatever who are on a magazine and everyone's like, "Oh, she looks amazing." I'm not saying she doesn't. I'm sure she does. But, they have access to different ways to make them look amazing, right? Like there's
Yeah.
there's no question that every photo is approved, that we're not with them in their bathrooms, right? Um, so so yeah, here's my story. I have for years now, years, and I've had other stuff done. I have a connection to plastic surgery. I have been around plastic surgery for decades. Like I understand plastic surgery very well. I understand it on the reconstructive side. I understand it on the aesthetic side. I work at aesthetics. Like all that stuff is true. Um, so for quite some, probably at least 10 years now, I have really wanted to do my lower bleph. So it's a blepharoplasty, a lower bleph. So the surgeon will go in, a technically skilled surgeon. Please do your research and don't come and tell me that you found the best surgeon because he has a really good Instagram account. Please don't do that. That's enough as a topic for another day. Um, but they'll go in and basically what they're doing in a lower bleph is, as you get older, the fat pads are dropping and they're changing positions and they're not where I would like them to be. So they go into an internal incision through the inside of the lower eyelid. So I have no incisions on me whatsoever. I definitely have bruising. Not bruising. I just have swelling. Go in through a little incision and then either take out a little bit of fat if you need some taken out, but really it's about repositioning the fat that's there because you don't want to get too hollowed out or anything like that. And then part of that was also having a brow lift. So the brow lift part is facial aesthetics works in harmony. So I always tell people this. I'm like, don't they're like, "Oh, I just want to get my eyes done." I'm like, "That's great. If you can't see and you just want to get your eyes done because you can't see, great. If you're trying
Yes.
to get a different aesthetic triumph out of this, then listen to your surgeon, do everything in harmony and have things fit together because if you just do your eyes and your brow is still dropped, your eyes, you can see better, I guess. I mean, but there are optimizations, let's just say that. So part of my experience was also getting a brow lift. In my case, it's an endobrow. It involves very small incisions, 2 very small incisions on either side of my head. And they take an endoscope down through your forehead, kind of through your temples. In this particular operation, they elevate the midface a little bit. And I did not have my upper lids done. So a lot of times people just do an upper and a lower bleph and whatever. Uh, okay, so that's my surgery, and I have a whole vlog on it because I thought, here's what scared the crap out of me, Rach. I have been in surgery like around this field for a million years, right? So me, Kris, I'm on the internet, I'm on YouTube. How am I going to recover? Because the biggest reason that I have put off this surgery for so long when I've been willing to do other surgeries, it's like, oh yeah, sure, I'll do a mid face, or yeah, sure, I'll do this little thing that I need to do with my breast, or I'll whatever. Okay, fine, I can fit that in, and no big deal. But the eye thing is, I was so worried that I wasn't gonna be able to see for, like, 2 weeks. Like, I just thought, like, you see these people when you go and do a little bit of research on YouTube or wherever you do your research, and you see these vlogs, and they're telling you how great their surgeon is and how great their experience was, and it's really not that bad, and when you know better, when you're in my position and you know that that's not necessary, and you know that that's not even half the times normal, it's it's hard. I mean, it's hard. So so as I'm watching all of that, I'm kinda horrified because I watched this one woman and she did a great job, and I mean, I have great respect for people who do this because it's a lot to give of yourself to everyone else so vulnerably, to talk about your procedures or talk about things that you want to have done, would consider, whatever it is. And she was Rach, I think, I mean, both of her eyes were like baseballs. I mean, they just look like, I mean, baseballs that had been, at the end of the World Series. Bromo, so I've never replaced. Like, super swollen. The bruising was outrageous, and, she was really sweet, talking just about her experience and about her, "Oh, my surgeon's so great," and, she was really lovely and told me, like, "This is normal, and this is normal." She's like, "And I'm really itchy on the inside, where my stitches are," and, like, literally, like, bruising everywhere. So this conversation is so complicated for me because I I have I have such a hard time when people with great intentions are misguided. And here I am, essentially an expert consumer in the field. I'm an expert provider, but I'm also an expert consumer in the field of plastic surgery. And to see people talking about their experience with normalcy in ways that I know in no way, shape, or form are normal.
Mm.
They're just not. They're just not. And yeah, so I have a whole experience of, of course I have swelling, you have this, but if you have a surgeon who takes really particularly good care of your tissues and treats them respectfully, and everyone's different, everyone's body
Yes.
heals differently, everyone's gonna have different issues, like, there's no panacea here, it's surgery. But there are ways really to mitigate the recovery. So I had that on Saturday. Sunday was I chilling? Yeah. Monday I had a meeting. I had an online meeting, no problem. I literally, I was so worried that I wasn't gonna be able to see. I planned all my tax stuff. I did every admin thing I had to do because I thought I wasn't gonna be able to see for 4 days. And I thought it was gonna be like super swollen. But instead of that, I'm like chilling. I'm just, I'm a little tired and whatever, just the normal kind of like up and down of that ish. But yeah, so I have a meeting then. Um Tuesday I had a lunch something. I Wednesday cleaned my entire house. This is like not advisable. This is what I was telling my sister. I'm like, when we talk about like you feel so great, so then you're like, oh, I just this little bench needs to get cleaned up. So I just did that, and then all of a sudden I'm in my closet, and I'm like, oh, I'm here. I might as well just do that. So I cleaned my whole closet, and I mean, just literally everything, everything. Um, Thursday I went to the office and did some procedures, did some work. Thursday night, I went to my new mahjong, learn to play mahjong meeting with my neighbors who I don't know very well, right? So I'm showing up like looking however I'm showing up, and I just, threw on my cute little hat and did my best. And they're kind of looking at you, but not like looking at you like you look strange. They're just looking at you because they probably don't know me. So that's Thursday. Friday, I forgot that I had a girls' night. So Friday, my girlfriend sends me a note. She's like, "Okay, you're good for the flowers, right?" I was like, "Oh yeah, totally, sure, absolutely, good for the flowers. What flowers?" So I had girls' night on Friday, and Friday, I have a very complicated. I filed my taxes on Friday, but for me, filing my taxes, and I'm still filing them. I still have to finish it. It takes about 10 hours. So, I did that all day Friday and then did my girls' night and then, had my Saturday of chilling and whatever, and here we are. So, let's talk about this because that that's my experience of
That
recovery.
is okay, that is so here's
Right?
the
And
thing, like
I mean, we all know that, yes, I like to do stuff, whatever, but
no, no,
but
no, no,
I
no.
was I was able to,
You were
and
able to
without flinching, I was able to.
yeah,
So, this is
so
what people need to understand, and then we need to talk about all the other things about the shame and the this and the
okay.
that and all the stuff that goes with plastic surgery.
Here's the thing, like, okay, first off, I'm gonna say you are not normal. Your recoveries, like, you bounce back from things like nobody else. I mean, I remember you bouncing back from childbirth. I remember you bouncing back from surgeries. Like, you are, like, indestructible.
Maybe that's
And,
true.
no, I'm gonna say this.
Well, but okay,
And
only the interjection is, yeah, childbirth, thank you, 'cause it's true. I was like, "It is true." I mean, 3 days later, I'm like, "Okay, yes, good," and I give everyone my secrets and no one listens. So if
I
anyone wants my
did, I
secrets,
listened.
yeah, you're the only one, you and one other friend. Literally, if anyone wants my secrets, of having 4 children and no tummy tucks, DM me. There's a system, it's pretty, easy, you just have to be disciplined, follow it. But the other point too, I bounced back because I have a good surgeon.
You do, and you not only do bounce back because you have a good surgeon, which I'm not, like, trying to minimize because I agree you have one of the best surgeons, and the other piece is you're going in healthy. You are going
Yes.
in as a
Oh, this
healthy
is such a good
candidate,
point, Rach.
which is a
Yes.
huge point.
Mhm.
And you also are going in knowledgeable, and I have to say, from my experience of having surgery in many different needs, like, for medical reasons and for aesthetics, like, I can tell you surgeons and like the office, they cannot prepare you for what you're
No.
about to embark on. The
No.
thing is you have the inside view. You're like the insider getting this done. So you
True.
have your expectations are totally set. Mine, I'm always like, what? What just
Yeah.
happened? You know,
This is so
and
true.
and I have access to you too, right? Like
Totally.
I have access to lots of information.
Totally.
And
Completely.
it is
Yeah.
still like, and I am like, I think you're on one side of the spectrum. I'm on the other side. Like, I get hit hard. Like, whatever complication, it's here. Like, and I am just really sensitive. And so some of that really, like, I get triggered in a migraine that I never get it, and I like, I swell up and like I have, anything around the face triggers my TMJ. Like, all of that is complex for me. And
Oh,
so
yeah.
my healing process, I have learned to go in with, like, 0 expectations, and often I actually even needing to reset them, extending my time for recovery, like, dialing it back more, finding subs longer for my classes, stuff like that, that I've learned that I just have to accept it when I'm in it, even though I didn't imagine it would be that way. And
Yeah,
that's
yeah.
part of that process is, like, you thought you might not be able to see for 2 weeks, right?
Oh, yeah, no, totally. Completely.
Me,
Yeah.
like, I thought, "Okay, in, like, 2 weeks or whatever, I'll be back," and I was like, "I am not ready to be back," so I have to reset my expectations
Yeah.
because how we individually react and respond to these procedures, any reason you have a medical procedure, it is we are all so unique beings, and it is
Yeah.
dependent on who we are and
Yes.
what happens in the procedure, right?
Totally.
And so I wanna be clear that, like, here as we discuss this and want to discuss this openly and honestly, there is a whole gamut that can happen. And I look at you as like the model patient. Like, here's Kris, she's the model patient, like she's the one,
Yeah.
and
Yeah.
then there's the rest of us.
Yeah, and there's the whole I love how you're saying this too, because it's like you're a yogi, right? You are an expert yoga facilitator, right? You have all the skills of, body function, understanding, hemodynamics, understanding body movement, understanding lymphatics, understanding all of that. So, that those skills go a long way in something like a surgical recovery. And and when you're bringing this up, the question that's coming to me is, similar to our questions talking about being sick is there some element of understanding, appreciation, and mental prep?
Mm,
Because we have talked about this so many times in our family that uh, so often patients come into surgery as though they're getting a haircut. They think they're just getting a haircut, like, "Oh, well, I'm just gonna go to surgery, and who's driving you home?" "Oh, well, I was just gonna, get a cab," or, "Oh, my sister's gonna come." "Is your sister a nurse?" No, she teaches kindergarten, but, yeah, we're gonna be fine, da, da." You just don't understand. I
yeah.
don't care how small the operation is or if "Oh, I did it in office." We don't do in-office procedures, but some people do. Well, rarely, I should say. Some people, it's more of their bread and butter. But even those, you are locally sedated, you are
Yeah.
not your own, you had your tissues moved around, your hemodynamics in your body change, there are all these fluid shifts that are happening, and I think it's when you're a patient, you have to understand that you have all these now you've made the choice. No one, or at least for us selectively,
Removed.
no one dragged you in here and said, "Get on the
True.
table, here's your rhinoplasty," right? You made the choice. Part of making the choice is being responsible for that entire recovery. And I will say, having been a rhinoplasty patient, I always say to any rhinoplasty surgeon, unless you've had a rhinoplasty, it just kind of like step aside because that recovery, it's different for everybody. That recovery is real. It's on your face. There's a lot of nerve issues you're going on. There's bone manipulation that may or may
Yes.
not have happened. There's grafts that may or may not be in there.
Yes.
There's just a lot of stuff. It's way worth it. It's worth every ounce of suffering. And anybody who can breathe now would say that. It's
Oh,
worth
yeah.
every ounce of suffering. But yeah, I like your point because yes, in this realm of surgical recovery, I do have a great advantage. I have probably an Olympian advantage of having been around it, seen it, done it, been there for other friends who've done it. I'm going to, be with some friends next week who are going through some stuff. I'm going to, usher them through this entire process because always say for those of us who are involved in it, it's, we see it every day. It's like, okay, which case is coming, which case is coming. But for the person who's having it, that's their one of one or one of two, or, they're not having surgery every day. So there's all this stuff that goes with it
True.
and the health is in what you
So,
say, because I didn't even talk about the things that I do on the daily this week
yeah.
to stay healthy.
Well, and before surgery, so I think there's 2 topics you hit on that I wanna dive into a little bit more and pull the thread on is the first one is the prep, like what you're doing to prep, what you're doing to prepare yourself. And not just on the health level, like, of, like, making sure you're not taking some supplements and taking
Oh, yeah,
these
I stopped
supplements
everything.
and,
Yeah.
resting your body and, like, all of that for
Yep.
sure. But then
Yep.
the mental prep, and I remember you were talking about rhinoplasty, and I can totally agree. I had a bad deviated septum, and
Yep.
I needed to have it. Like, I had, like, being a yo-yo and not being able to do opposite nostril breathing was, like,
Yeah, same
really.
for me, it was running. Yeah, I
Yeah,
couldn't
it
I
was
couldn't run long
I couldn't.
distances. Yeah.
Yeah, I couldn't get a breath in through my nose, and in yoga, you
Mhm.
keep your mouth closed 99% of the time, so it was like it's like someone strangling me while I'm trying to breathe, but I remember before that surgery, mentally, it freaked me out because it is a
Yeah.
big one, right? It is
Oh, yeah.
huge, and
Yeah.
it's right on your face, it's like your airway, like, all of that stuff is, like, terrifying, and I remember going through this process of visualizing and writing how everything was gonna go that day to ease my nerves. And
Yes.
that is the mental preparation. So the
Yeah.
physical preparation, I like that is a key part, but there's a mental preparation. And for me, anytime I have a big procedure, when I had my knee repaired and stuff, sat down and I wrote all in detail that morning, how I woke up, how I got dressed, how I got there, how they greeted me, how got
Uh-huh.
changed, how everything went, how I woke up, how it felt, like all of the things. I detailed it out because I wanted to, one, visualize how it's going to go, like to ease my mind,
Yeah.
and two, almost like manifest how that's going to go.
Correct.
And
And yeah, you're giving your mind the signal of what this is
totally.
gonna look like. Yeah.
And I'm creating it, and I'm not creating anxiety, I'm creating ease in it.
Right.
And I'm someone who is, like, very afraid of needles, blood, like, all of that stuff, like, it's not my jam, I am not the nurse here.
Am I allowed to talk about your Botox treatments?
I, like, pass
You're
out.
you're once every 2 years, "Rach, hey, come on, let's just do a little Botox." "Are you
No,
sure?" "I don't know."
do you
"Oh
remember the
my
first
god."
time?
Okay.
Like, I was watching someone get it, and I basically went white,
Yeah,
and
I
then
know, we have to watch for people
the doctor's
flopping,
like,
yeah.
You need to put your head down." Like, I was like,
Well, yeah, it's just that's a funny joke, yeah, because it
"It
says,
is."
like, remember to put your head back if you're one of those people, yeah.
Yeah. So there's the mental preparation, but then, um, that is a key part of it, right? Like, because you want to walk in
Yeah.
mentally prepared, in your head, and you want to visualize, like, what is it you want? How do you want to feel? How you recover? Like, what that looks like, for sure in that process. And that is like, for me, I don't want to walk in anxious, and I am like that. It makes me like having any surgery makes me anxious. Like, it just
Yeah, I
is
mean,
like,
and rightly so.
yeah,
It's a vulnerable position. You're going under, well, often general anesthesia. You're relying on people to know their stuff big time. They're relying on you to give them accurate medical information that so they can help you. Yeah.
yeah. So then there's the other piece that you mentioned, and I think this is like, I mean, I think my lucky stars for you because you have been a part of my recovery team every time, right? Like, you've been there, and you're the one, and it's right. Like, you're like, who's picking you up? How is that going to work? And even here, like when I was here and I had to have my knee repaired, I was like, okay, it's me and like my teenage son. He's not here to take care of me. So I like literally, I had a friend move in with me for a couple days because I was like, I'm gonna need help.
That's the best idea. Yeah.
Yeah, and it really made such a huge difference for me. But it's like, who is on your team? So as you do your mental preparation before, you form your
Mhm.
team along with that. Like, how's that going to work? Who's going to step in? How are you
Yeah.
going to receive and accept support if you need it? And
Yes.
like, personally, like, recovering at your house is one of the best places.
I run a very good aftercare here.
I know,
It's chez
but
moi.
people don't think about the aftercare. Like, it's
Yeah.
you're done and they're like, "Oh, we're done." And I'm like, "No, no, no. There's like a whole process afterwards." Like, the surgery is like one tiny little bit. The
It is.
before and the after are like huge chunks of how this goes. And you hitting on those things is really important as people look at this idea and this topic of whatever they're doing, whether it's, medical procedures or purely cosmetic or whatever, is like, how do you build the best outcome possible? How do you
Uh-huh.
put that together?
Yeah.
And and not just think, "I'm just gonna get it done, it's gonna be fine." Like,
Wow.
you need to it's like when we had the conversation about being sick, like, you need to give yourself time to recover. You need to give yourself space for that, and how
In
do
this
you
way,
do that?
especially, yeah.
Yeah, unless you're Chris and you bounce back super fast.
No, well,
But
but even that, I'm even that, I have to give myself more than 2 hours, you know? Okay, it's a 2 hours recovery, check. But what you're talking about is so important, for people to understand because the real work begins when the surgery ends. Like, your work begins. The surgeon's gonna do a great job for you, I hope.
yes.
And honestly, please, for the love of God, DM me. I will help you find these people. There are surgeons who are better than others. There are people who are very skilled at this, and there are people who are not. Who you wouldn't let your operate on the dog, the rat at the lab. It's true. So there are big, expanses of skill, but that also determines outcome. that also determines outcome because, my ability to flow through this is only made possible because I have one of the greatest nurse anesthetists in on the planet. I have her. She's my requested person every time because I know that I'm going to wake up as though I just was in a little, dream. No, I just had this nice little dream. I'm not. There's never one stitch of nausea. There's never one stitch of like I don't feel awesome. There's never one stitch of like, oh, I'm groggy or I need to throw up or those things aren't normal. So everyone just needs to understand that is not the way it needs to be. Especially in elective surgery, you have options. So having said all that, yeah, for sure. But the prep after, okay, I would love to have the product, whatever you were talking about, your pre, like kind of what you did.
Mm,
Let's
yeah.
make that for people
Okay.
because I think that's a really relevant thing because it's not just like a regular journal where you're like, oh, I'm feeling great today. Da, 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 da. It's a very specific it gets your mind aligned, especially if you've never had a procedure. It gets your mind aligned to what this is and gives your mind the mental space that it's going to take to do the recovery. And then, by the way, not be calling your surgeon's office every 12 minutes. Oh, this doesn't look. We're happy to have you call. Like you can call anytime, but it's also you don't need to worry. There's so many things you don't need to worry about if you're prepared for the process of what it's going to look like and we always want you to call rather than not call. But if you're prepared for the process of how it's going to go, and do not think that you can do this stuff on your own. This is one of those times where it's like, you don't be the hero. I say it to everybody. I just was talking to someone else who had a knee surgery and, it was, well, I have these pain meds. I'm in a lot of pain. And I was like, hey, did they give you some pain meds? Oh, yeah, they gave me, some this and that, obviously narcotics. And then some, and people get freaked out. Like, I don't want to take narcotics. I don't want to end up being an opioid, addict. You are not going to be an opioid addict because those pain receptors have a place to go because you have pain. So when you have pain and you have a drug that's designed to find those receptors and attach to them, guess what? You're not going to have pain anymore. And that's what they're designed
Yes.
to do. So you're not going to become an addict. The whole point about pain is the signal for your body to like that. Taking care of that pain is what allows you also to recover and to keep doing better and to, go through the whole thing. So
But
I would love to have we'll put it together. I would
yes,
love
we'll
to
put
have
it
your
together.
version of that,
Yeah,
because
and
it's like you said, pre,
we
middle, and recovery. And by the
yeah.
way, some of these rhinoplasty patients, if you're a rhinoplasty patient, you're not in active recovery for a year, but your result is continuing for a year. And a lot of the procedures that I even do as in aesthetics as a nurse, the results keep coming for months and months because we're working on systems that keep renewing, collagen coming back and whatever. So yeah, I would love to do that for people just to, show what's
Yeah.
there.
And it's like, and it's not just the process of it. Yes, I can write out like we can put together like how you write it up, but then you reread it every day, like multiple times a day. So you're like so familiar. And our brains are designed to fill in gaps. And when we don't have information, it tends to fill in the worst case scenario. So I fill in like every gap, like exactly what I'm wearing, like who's
Yeah. Oh,
driving,
nice.
like,
Yeah. Yeah.
like because then my brain has no space to put in random stuff that is not going to happen, that is more on a negative side.
Right.
So, and then I read it and I read it and it becomes like actually feels like it's like I'm now telling myself the story of how it's going to go. And I know all the details, which is great. And then to your point about pain, and I don't remember who told me this, but they were like, you stay in front of the pain. You stay in front of the
Oh,
pain
yeah.
and you never like, it's
Yeah.
not
Keep
like,
keep
oh,
it keep ahead of it. Yeah.
yeah, ahead of it, because once you're behind it, it's really hard to catch up, and I have to
Yep.
tell you, that was so true on many and especially in knee surgery, like joint stuff, it is like,
Yep.
get in
That's
front
what
of
this
that
that's what this
stuff.
guy was dealing with. Yep.
Yeah, and it is, like, this is not a time to be your own hero. This is a
Yep.
time to, like, lean in and be like,
No,
"I
and
got."
people also forget. I mean, we'll move on from the technical side of this conversation, in a little minute but there's so much more to talk about too. But the problem also that people don't understand is you're under anesthesia during your surgery. So you come out of your surgery and you think you're fine. And then you go home with your brother or your, kindergarten teacher aunt And not that they're not lovely people, but they're not medical professionals. So if you're not in an aftercare facility, or you're not with a nurse, or you're not with someone who, understands this stuff, you might miss that first pain med because you're feeling fine,
Yeah.
not realizing that anesthesia every minute is wearing off. That's the whole point, And by the way, you should be drinking fluids to get it to flush out of your system even faster. So, like, this drug needs to be in you, like this little, pain pill needs to be in you. And then again, it needs to be in you again. And it needs to be in you again. And you do that for a couple days. And then you can say, like, all right, I'm done with the narcotics. Like, you don't need to stay on for a week. They'll give you a huge supply. You definitely don't need that for the most part. Most people don't. But yeah, not to be afraid of that. So what I want to bring everyone in on the conversation of this, especially in the grateful, not greedy side, because I also had anxiety about this particular procedure, and I'm not an anxious person in general about procedures. And I think this, because it's your eyes, and it's not like I wasn't at all worried about my eyes being whatever, but the eyes are like the key to your soul, right? And right, let
Yeah.
me just tell you psychologically kind of what went on
Yeah.
for me, because I I'm not someone. I have a vanity space in my life too, for sure. Yeah, but it's all also built on working out and taking care of myself, and doing some peptides here and there, and like, I'm an optimizer. I'm not a massive biohacker, but I pay attention to that kind of stuff. So the the idea of also looking at your eyes is, it's one of the my eyes are one of the things that I get complimented on. So now I'm looking at something that really bothers me, which are my little bags under my eyes. They're still kind of there, I'm sure, because I'm still there. I'm way swollen. I mean, I'm a week out. Forever, and people just relax if they're like, "Oh, she doesn't seem like she had her eyes done." No, I mean, I'm like, I'm a week out. But when you talk about changing, and this is a real thing. This is a real phenomenon that people also have to understand. So I had a little bit of anxiety about it just in general, because my eyes are so fundamental to how people see me. Like, I literally, I know that people have a reaction to me because of, I didn't pick my eye color. I don't have anything to do with it. Thank you, mom and dad. But for whatever reason, and I didn't want that presentation of me in the world to change. And it wasn't even like, oh, her eyes are so beautiful. Some people just have these like striking eyes that you're just like, wow. I think mine is more like the soul. I think it's much
Right.
more
No, I
like
agree.
soul. I don't. You can speak to it because you know me, but
Yeah.
I feel like people react to it. So there's that too when you're changing, and people go through this with their nose too, or their face or their breasts or whatever they have going on. I mean, there's all kinds of reconstruction things that people need to do or desire to do, to kind of have things to get the more self-confidence. But in the same light, you're you're in conflict a little bit too, because you know what you know, but you don't know what's gonna be on the other side of it. And that that kind of like plastic surgery blues, especially after things like rhinoplasty, people definitely go through this. Maybe a little bit for the face, but honestly, facelifts, I feel like people recover pretty easily from. It's not an extremely invasive operation, other than the brow and, neck lifts, maybe if you're doing a lot of dissection. But I can talk to anyone offline. DM me. I'll talk to you for hours about that kind of stuff. But like the nose and things like that, where it's really part of it, and you're worried about changing, and then you have that minute, or some people do, 2 days, 3 days, a week, 2 weeks after, where you're like, "Why did I do this? Why
Mm,
did I even touch
yes.
this?"
Yeah.
And I will say, rightly so, if you are in the camp of having unfortunately chosen and trusted someone who did not, bring their A game and does not have an A game, um, it's really sad and really unfortunate. And I'm not saying that to scare people. I'm saying that to remind people that your Instagram doctor is not the expert. The chief at, your local university is not necessarily the expert, right? That they're an expert in, they might be, but they also might be an expert in writing papers about fat transfer. You just don't know, so it's really important to know how many of these they do. Well, what is their specialty? Do they understand all this stuff? I could talk about this to ad nauseum. I'll probably do we easily could do a separate one. I'll probably just do it on my own. A separate one if people are interested in this topic, because this is something that I know a lot about. But what I want to get to is also the grateful, not greedy. Is it okay to have plastic surgery? Is it incorrect to judge people for having plastic surgery? Is it okay to flaunt your plastic surgery? Because in my world, it's not. Like I can tell you, there are very few things that get me more get under my skin than women who flaunt their breast augmentation results. And I'm just gonna say that. I'm just gonna call that what that is. I don't I love the fact that and especially for people who have reconstruction, and have real problems, because if you've been in rooms and you understand what women go through, some people have real problems, and they've had real self-esteem issues since they were, 12, because one breast is a D cup and the other one is an A cup, by example, stuff like this. There are those things. And then there are the other situations where I feel like it's so tempting to get into the I'm so proud of myself, like, I love myself so much. There's a fine line between, "I look great, I feel great, my self-esteem is sky high," and, "Oh, too bad all you BI blah, 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 fill in the blanks." You would do it if you would, if you could, kind of stuff. And, that to me is obnoxious, and it defeats the specialty, it defeats women, it it hurts the process of the progress that we make as women, especially breast talk. I mean, it's like, come on, let's, like, talk real shop, right? Um, so what about that? Because, you look at, the Kardashian family that we all know and love, great, like, I could not be more impressed with a woman who takes her family into an empire level like that. I mean, it's just the respect that I have for someone who can, just on a business level alone. I don't know her. I don't know anything else about it. But on a business level alone, that you can make those decisions and, make whatever choices, whatever, good, bad, ugly, I don't know. But to have those outcomes. But those are all plastic surgery results. Those are all that life is possible because of plastic surgery. 100%. Like, without question, the optimization of it is happening because of plastic surgery, right? And that's probably replicable in many other fields. Having said that, you will take a 15-year-old kid and you will get them a rhinoplasty that they have begged their parents for, since they were 13, and 15 is kind of the age, right, where you can really think about doing it, where your bones are where they are, and you have changed that child's life. You have altered the course of existence for the rest of time for that child, because that presentation now, that that kid has all the confidence in the world. That kid is going out for student government. That kid is, applying for the job at the yogurt shop. That kid is asking the girl or guy out, going to homecoming, doing, everything change. We see it all the time. Everything changes because now the signal is, I'm okay. I'm okay. Yeah, I was getting bullied for this, or I was getting this, or it's, oh, but for her nose, or, oh, but for his, no, oh, he's got such a big nose, whatever the heck. Um, so there's just a lot of complicated conversations, I feel like, in aesthetic surgery, and this is why I want to be responsible talking about mine, because I'm not ashamed of it at all, but I'm also responsible with it, and I feel a great responsibility for being of service to people rather than being of shame to people. Like, oh, don't, it'd be great. Wouldn't you love to get this too? No, no, yeah, no, yeah, no. I want to be of service. Is it something you want to do? Is it a priority you want to make? Are there funds that you can take from something else to do this? This will, has the capacity to change your life. Do you want that? There's just a lot. Probably could have a whole separate job in just plastic surgery coaching because it is
Yeah,
so
it
it is
is. Because
so
there's
complicated. It's so complicated. So reflect on that for me because I want to support people also who maybe are, on the fence about it because of the shame of it.
mm,
Because of
yeah,
what am I gonna tell my friends that I had a procedure? And everyone, I'm sorry, you're seeing anyone on the red carpet, they're all doing something. If they're not, "Oh, I've never done anything, I've never gone under the knife." Okay, they have expert facialists, they have lymphatic, whatevers, they have expert chefs, they have, everyone is optimizing them, or not, the people who are just, like, gave up, I mean, that's fine for them too, like, but the people that you see that don't even look normal attainable, it's because that's that's tens of thousands of dollars a month
yeah.
of maintenance. It just is.
It is. It is, and I think, you hit on it. It's like, what's the reason for you to be looking at this, and why are you approaching it? And the question is, are you doing it for you? Are you doing it for something that you wanna see that is, like, makes you feel better as a person? Or are you doing
Mhm.
it because someone else said, or someone else was like, "Oh, yeah, that's like yeah, balance yourself out, you should do that," you know? And that's a slippery slope because then there's always
Yeah.
something next.
Oh,
At
yeah.
least in my opinion, like, that
Oh,
is,
yeah.
like,
Yeah.
there's because we are not, like, we are not symmetrical beings, we are not, like, we all have uniqueness to us, and the question is, it's like, what is driving this for you? And if you think it's a person, if you took that person and moved them out of your world for a moment in your head, like, would you still be considering this? Like, would this still
Mhm.
be important to you
Yeah.
with or without that,
Yeah.
thing? And I can't imagine, your example of like the 13, 15-year-old that, has a rhinoplasty, like, and those that absolutely can be life changing. And
Life-changing.
the other
I can
piece
attest
is
to it. I see it every day.
yeah, and I'm sure you do. And I have witnessed someone who got through it and they became a different person because of the confidence.
Mhm.
And to think like how amazing to do that at that point in their life where that confidence we're still building it so much at that point, and instead of,
Yes.
like, pushing it down the road when they finally have the ability to do it on their own in their, like, mid to late 20s or, like, there's a whole window of confidence and experience that they probably shied away from
Oh,
because of where they
definitely.
were, and so
Yes.
there's, like, um, the so that's incredibly powerful, and then you're right, there's the shame piece of, like, I don't want people to know, like, they
Don't want
shouldn't
people to know.
know,
Yeah.
like, all of that stuff, and it's like, why not? Like,
Why
everybody
not?
knows that I work out, right?
Yeah,
Right?
exactly.
And,
Yeah.
like, and I take care of myself, I, like, take supplements, I have someone who, like, looks at my blood work and, like, helps me understand my body, and, like, you can do all of these things, and I was like, this is another piece of that.
It is.
Whether it's right for you or not, that's totally up to you. Just like some people choose not to do supplements. Some people choose not to like lift weights and they do something else. Like there's all sorts of ways to approach this. And this is one of the pieces. And all
Uh-huh.
of them go back to what does this do for me? How does it make
Yeah.
me feel? Right. Like I don't do yoga because like I feel like it like makes my body the way it looks. Like I do it because it feels really good and I connect to myself there and I feel really at home there. And, like, the side benefits are amazing, right?
Of
Like, it
course.
makes me
Yeah.
strong, it
Yeah.
makes me
Longevity and
flexible.
everything. And yeah. Yeah. And you look great. Yes, of course.
And so, like, the question is, like, why is there shame associated with that?
Right, because there's not a shame
And
with you doing all your yoga. There's not a
no,
shame with you, you can go out and lift weights, and it's totally why? Because that's healthy, but the psychological benefits from plastic surgery are undeniable. They are undeniable as someone who's in it, who sees it, they're
yeah,
undeniable. So, your
but it
mental health is different from your physical health? Like, what?
yeah. Well, but here's the thing, Chris, is then there's the other side of it too, right? Like,
Yeah.
there's both sides to this. Like, it is undeniable
I
what
think
that
there's
can
like
do.
32 sides to it.
And
I
then
think
yeah,
it's like
yeah,
a
but there's, like, you know,
thing. Yeah.
the other side that we see is it becomes this, like, it's
Chase.
obsessive and, like, a
Yeah,
chasing and everything else, and so there has to be and that's also true with working out. That's also true with
that
eating well.
is.
That's also true with all of these things. It
Yes,
happens everywhere, you know, there's a slippery slope, and so that's where I think, you know, the physical and mental preparation of, like, what is this you're doing? Like, why are you doing it? What's it and, like, do you think will you really be happy at the end, or is it just gonna be breathe the next, and the
right.
next, and the
Yeah,
next?
yeah. Or are you
You know
really solving a prob are you looking for a solution for a problem that has a different solution? This is not the solution to the problem
ex
you're trying to solve. Yeah,
exactly,
yeah,
exactly, and
yeah,
spending the
like,
time
I'm
trying
gonna change myself so that, my spouse won't leave me or whatever, and it's like,
right,
don't no,
find me more
don't
attractive,
do that. Do
like,
like
yeah,
don't
all
do
of
that.
that stuff.
I can guarantee you that's a lose, you know? Yeah.
Yeah, for
You
sure.
might wanna leave them after, actually. I that's more possible. That's more
Yeah,
possible, but yeah.
but, it's a really it's a big topic, and if there is shame associated with it, like, where does that come from for you? You know,
Where does that come Yeah.
like, where did you pick that up? Did you pick that up, you know, and I think especially you live in Southern California. I live in
I
Hawaii.
sure do.
Southern
Yep.
California, it's extremely normalized, right? Here, not as
It's
much.
normalized and it's also pressurized.
Okay, good
It's
point.
also pressurized, I would say here. Yeah, where and I think that is probably at the crux of why people would be, um, reluctant to talk
Mhm,
about things they have because as though your ability to optimize your look is somehow shameful, and
mhm,
I'll just speak personally, whatever. I'm just a person with a mic, whatever. I have been we've had this conversation before. I've been the most gorgeous woman in the room, and I've been the one of the least gorgeous women in the room. Like I've had the experience of life where I've had plenty of attention from people, like attractiveness wise, right? I've my whole life. Not like this is not about plastic surgery. This is just like about just being a person through life, whatever. Did I chase it? Was I like da da da? But I've also been, like literally on the same day, I can be in one room and be the most gorgeous person in the room. And the next, 2 hours later, I'm the least gorgeous for however you're going to qualify that, right? And especially in high school, and people are so mean, and you know, I grew up in the 80s when, we did all kinds of experiments with our hair that maybe weren't so, I'm like looking back, maybe not the best choices, but or people who have, like these big glow ups or they have these, teeth issues or something and then they get them fixed. It's like, of course you're going to get your teeth issues fixed, but you don't want to optimize your facial tissues or you don't want to optimize your whatever, your neck or if you have, men don't have breasts necessarily to deal with, women do. There are realities there. Men don't have children. They don't give birth to multiple children. There are lots of things that happen to your body there. That is a massive way to be able to take care of yourself. And I would say if you're one of those women, who's had children, who wants to, feel has somehow because some women skate through the whole childbirth thing and the post and the first baby. Most first baby people will never, nothing will ever happen to them. Second baby people, usually pretty fine. Third one, that is the ticket. That is the ticket to your skin laxity. That is the ticket to your diastasis. That is the ticket to, things kind of like not exactly being, especially if you have them close apart. There's just a lot of stuff that goes on with your tissues. But, are you embarrassed about that? Are you, is it's not okay to say that you had a tummy tuck because you gave birth to children? And you would like to, you know, accept, of course, sure, accept your body. If you gave birth to children and you breastfed them all and you want that experience to continue for the next 30 years of your life unaltered, have at it. But in no way should any other woman have to take judgment from someone for making a different choice. Like, in no way should that woman ever have to take judgment from someone or someone, a breast jog fine. Some people just have a preference for a certain size breasts. And in Southern California, the numbers, I just can't even, just can't even get my head around it. Honestly, I'm like, is that really even like a number in real life, you know? But you know, people are into that. Okay, fine. But again, check yourself. What is that about? You know, what's going on for you? Is there something else there? You know, and even if there is, fine. If you understand it, it's all fine. You know, everyone's making their own choices. But it's just occurring to me this week as I am doing my recovery, you know, so it's all these multiple things, right? I'm doing my recovery, making sure that I'm taking my zinc, I'm taking my antibiotics, I'm taking my all my support stuff, you know, my arnicas and whatnot. I'm taking my mental load, I'm taking my little rests if I need to. You know, I'm doing all those things, but you know, first picking a really good surgeon, thank God, you know, I have access to that. So, you know, doing that first. But, you know, I wanted to talk about it because I want people to know if you want to ask me what surgeries I've had, I will tell you. Yeah, I'll quote my brother-in-law. I love him. He's the most hilarious guy. Um, so my brother-in-law, when I was doing this kind of stuff and I had this because this you do the lower breath. The lower breath comes with the brow. If it doesn't come with the brow, then it's awkward. You know, it's strange. You know, you do a mid face, you know, then that comes eventually with the neck. You know, it's just like it's one thing, it's another, it's whatever. And my sweet brother-in-law is like, that girl's had some work. If you know me if you know me as a person, you know how hilarious that is. Like, it's like the funniest thing that anybody could say about me, you know? It's like, do I chase it? No. Like, do I love it? Yes. Do I think it's really great for people? Do I love that people get joy out of plastic surgery and out of aesthetics and, you know, feeling good about themselves? Yes, it's a passion of mine. It's a massive passion of mine, but so is reading. So is, you know, getting smarter, you know, so is getting healthier, so is lifting weights. You know, these are all passions of mine because I'm I'm cheerleading for people for anything, for whatever they want to do for their life to, you know, feel better, do better, you know, learn more, have at it. And if plastic surgery is on that had dude, this girl's had some work, then have the work. Like have the work and no shame. Like no shame. I was plenty attractive before. I am plenty attractive now. To me, there's no difference. You know, I'm only optimizing what like gravity is taking away from me. You know,
Yeah.
gravity has more energy than I do. I'm only optimizing those kinds of things, and I personally enjoy the process of the maintenance of taking care of myself. It's just
Yes.
something, it's just part of me. It's an expression of me in my life. So maybe you have a reflection.
You know, it's interesting because I would pose a question for you. Given where you live and the environment you're in and where you work, this is part of who you are, right?
Conceivably.
And
Yeah.
yeah,
I'm an
uh,
outlier. I think I'm an outlier even in that in this world for sure.
yeah, you are for sure. And I would say, for us, like, and I look at it too of here, of being here, it's like, where, like, um, where is that when I'm considering something, like, when I had my rhinoplasty done, it's like, why am I doing it? What am I gonna get out of it? Like, what is the drive here, right?
Yeah.
And, um, and it wasn't something that was super normal. It wasn't something I was around, right? So it was just like a big leap for me, and it just took time to like understand like what is the reason and where am I and what's driving this,
Yeah.
and it's just like, you know, and and then the question later was like, why did I wait so long,
Why did I
right?
wait? Yes.
And that
Yes.
is, and that, you know, we were talking about the shame piece, and I was like, I think it was like shame, right? Because I'm like, well, like, I don't want to do this, like, I don't need it. And then afterwards, I was like, oh my gosh, my allergies changed, my breathing
Oh, mine
changed. Like,
too.
it's just like,
Yeah, oh yeah.
it was such a
Totally.
huge shift. And
Yep.
it was myself holding me back. And it was my shame that was holding me back. And so sometimes it's not the question of like, um, why do it? But it's like, why not do it? Right?
Right.
Like,
Yes.
what is that? And then it made me realize I'm like, and now when I think about things like, with my knee, I was like, I want to get this done as soon as possible because I know that it'll make my life better. Like,
Yes.
and I want to get the most mileage out of this. Same thing, like, and to your point, when we're talking about the younger, like when someone has a rhinoplasty at a younger age, because it's such a personal issue for them to be more confident in themselves. It's like, get the most mileage out of it, right?
Yeah.
Like,
Yeah.
and so for
Yes,
me, I
definitely.
guess this
That is definitely true. Sooner rather than later for sure on that. Yeah.
exactly. So this conversation reminds me that, like, um, it's like, I don't wanna it sounds funny when I say this, but, like, when you redo your kitchen in your house, always after I know it's a painful process, but when you do it, you're
That's
like,
right.
"Oh, man, why did I wait so long?"
Why
Right?
did you
Because
wait so
they're
long? And no one's like, "Why the hell did you do your kitchen? Your kitchen was fine.
yeah,
Why would you need
and
to do your kitchen?" No one
and you get
says that ever.
no,
Ever.
and you get so much joy from it, right? And the same thing
So
can
much.
happen here. And it's like, sometimes it's me that's holding me back, right? It's
Mhm.
me that's like prolonging. And you even said for this one, you're like, I've waited a long time to do this. And
Long
for
time.
many reasons you did. And
Yeah.
I was just like, get it. Like when you said you're fine, I was like, oh, thank goodness. Like it's like, get it
Just
done because I
do it
know
because
it's
'cause I've
been
been
on your
talking about it
mind.
and it's
Right.
annoying. Yeah.
Yeah, and not annoying, but I'm like and
Thank you,
I
Rachel.
trust you know when you're ready, but I was like cheerleading you on, being like, "That's amazing, I'm so glad you're getting it done," because I know it's going to have a just such a positive effect on you, and you're gonna be so pleased with it. There's not gonna be a moment, and there will be like, I always have this after surgery, I'm like, "Oh my god, this is the most painful," like, there is a moment of like, "Oh, this is the worst." I know I go through that every time. I just know
Yeah.
it. Like, whatever it
Yes.
is, like,
Yep.
it can be everything, like my knee or, whatever. I'm always like, "This is terrible. Why did I do this?" And then afterwards, I'm like, "Oh my gosh, I'm so glad I got it done." But that's just part of me of, like, hitting that bottom part of, like, this is painful, this is uncomfortable,
But that's an
and then
actual there's data on that. That's an actual thing that happens for people.
yeah,
Yep.
and know that that's gonna happen, but
Know
when you
that
come
yeah.
out and when you recover, and that recovery can be short or long, that can be easy or challenging,
Right.
when you get through it, like, for me, it's always been such a positive thing of any way I can take care of myself for the right reasons,
Right.
and to realize that sometimes holding back, there's probably a shame piece there for me, and,
Yeah, I love the shame piece. I know we can't talk for 2 hours on this piece, but let's just wrap in here because the I'm reminded of a girlfriend of mine who shall remain nameless, who was talking to someone about a decision that she had to make, and the guy said to her, "What is your aversion to happiness? What is your aversion to happiness?" Because she was fighting so hard to stay in a decision that was causing her so much grief and
Mm.
so much pain and so much, demoralizing feelings and, self-esteem issues and all of it is a plastic surgery version of this, right?
Yes.
Um, and that has stuck with me so strongly. And I ask myself that often. What is my aversion to happiness? Why am I so willing to put up with so much? Why am I so willing to be, the strong one, the one that's, I'm not going to do it. I'm just, my friends don't do it. I don't want to do it. And, you know, it's whatever. Jane down the street can't afford it. I don't want to, be the one in our group who, yeah, whatever, whatever, whatever. But the concept is really it's such a personal decision, and we've had the discussion about friendships. If you were around friends who can't support these decisions that you wanna make for yourself, get new friends
Yeah,
tomorrow.
good point.
Tomorrow, because if they are threatened by who you are becoming or your desires for your life or your willingness to, expand yourself and become the version of, we're always talking about this, putting yourself into the version of who you want to be. Where are you going? I always have avatars in my mind of women who I respect so much, uh, personally, physically, academically, intellectually, career-wise, whatever. I always have an avatar, and it's easy to make decisions that way because then I say, "Oh, would so and so, would Ruth Ginsburg do this? Would she think about it this way?" Or, anyone that I admire, physically, would Jillian Michaels, would she do this exercise this way? Would she skip these 14 workouts? Like, no, she wouldn't. So, yeah, I think just being able to be comfortable knowing that. Also knowing that whoever you're seeing on TV that you think, "Oh, they look amazing. Oh, I don't have anything done, da, 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 da." Ignore that. It is likely not true, and even if they haven't had anything done, their photos that show up on the internet have had things done to them.
Yeah.
So you can say, "I haven't had anything done," like, all you want, and even when we're watching TV, I was watching something the other day, and I said, I was like, "God," I was like, "She looks different." Like, I don't, and then I was reminded that now we have AI for all of that stuff too. So
Yeah.
even when you're watching a talk show and you think you're watching a talk show and you think you're just watching the person in real life, one, you're watching them digitized and, optimized and whatever for film, but which you always look better on film. Just think about your wedding pictures. You're always looking way better in your wedding pictures than you're ever looking in just real life. And you're not a different person. It's just that the lighting comes a certain way and this comes a certain way. So say you're going on The View and you're like, "Wow, she looks really good." Yes, because everything is geared toward making them look good. That is the point. So it's not real. It's not real. But what is real is you looking in the mirror and deciding, "Oh, I don't like that I can't, see that the hoods of my eyes are literally halfway down my iris. I don't like that I have jowls here and, I look older than I feel, like I don't like whatever. And there are money investments to be made, there are decisions to be made, there are all those kinds of things. But as we both of us here would agree, if there's something that you're thinking about and it's for you, find the way to do it sooner rather than later because you are going to, just like getting your kitchen done, you're gonna enjoy that kitchen for the entire time. I did my kitchen 15 years ago. I don't think I will ever redo it again. I'm not that person. Like, I'm not like, "Oh, and then I need to do this, and then I need to do this, and, oh, can I just do another one of these?" And that's why I say I'm an outlier. I'm not I love it for people. I'm not like I also love looking a certain age. I don't need to hang out with different not my cohort. I love my cohort. Yeah. So I just think there's so many things to talk about in this, and I just wanted to bring forth my little story and my little experience this last week of having a lower bleph, having an endobrow, having a recovery situation, having, just any little pieces. Had a little lipo in this one spot that drove me crazy that I was like, "Can we do this?" And they're like, "Yeah, it's like not even a thing." But I was like, "But is it a thing that you can do?" Like, "Yeah, okay, sure, yeah, it takes 12 seconds." Like that's not a big deal. So even stuff like that, when yeah, you're just fighting yourself, you're fighting the world, you know, I don't know, like you wanna be natural, but then you wanna drive the most advanced car. So it's like you have to kinda check yourself at every right? You're not out there with a horse and buggy, are you?
Right.
Right? I mean, you're not saying like, "I'm not gonna use lights," unless you're Amish, and good on you, right? So I think that's like, there's just so many logical ways that you can approach this and that you can be kind to yourself in these decision-making process. The biggest way that you can be kind to yourself is to do your research not on Instagram, please, not on Instagram, but, on ways, uh that you can see people's actual results. You can see people in real time who've had real surgery, who don't have cuts all over their face, who don't have, obvious looks, who don't have windswept anything, who don't have if they look amazing, the chances are they've had really good plastic surgery, honestly. At a certain age, if they look ridiculous and you're like, "Wow, you look so good," the chances of them having had really good plastic surgery are, probably 80%, truthfully.
Mm.
So, just to encourage everyone and just make sure everyone knows that,
Yeah.
that's real.
And I appreciate, Chris, you bringing this topic because it's a vulnerable place for you to come from right now because you're in the middle of recovery
Oh,
and you're
yeah,
sharing your
totally.
personal story. And I really appreciate your openness and your willingness to share this because it is, you know, that I think can help with some of the shame piece for people, right? And that's the whole
Yeah.
point of this is like the grateful, not greedy part of it plays in here of like doing it for the reasons for yourself, for the right reasons, without shame and knowing what it is that you want the end result and not, snowballing along the way of just like get there and there and there and there. Then it becomes, you never get off that wheel.
Well, that's the
But
greedy. That's the greedy.
that's
The
the greedy
greedy
part,
is like,
right?
yeah. Mhm. What else?
And
What else? What
like
else? What else? Yeah.
removing the shame to have the grateful part, right?
Yeah.
So all of those pieces, I do appreciate that. So thank you.
Yeah, and thanks for saying that because it's just as easy for me never to talk about it. It's just as easy for me just to, kinda be chilling and doing my life and, I don't see that many people on any given day, like, I'm a pretty private person, I kinda just go about my life. So, but being able to be a champion for women and for men because men there's a lot of great stuff that men get from having a
Yeah.
facelift,
Yeah,
from
for sure.
having their having little tweaks done for them, getting little body procedures or whatever they've got going on. You know, there's there are men that benefit from it. There obviously we have a whole life of transitioning situations the plastic surgeons deal with. There are the teen rhinoplasty thing, I just can't say enough about that. I can't say enough about that. If you are a parent and your child is asking you and you are looking at your child and you can see what they are talking about, at least just take them for a consultation, just at least, because that is something that will literally alter the course of their life. If that's another issue, right? Maybe you're like holding on to like, oh, but I want them to have my nose and I want them to have this. And they might not even have your last name for your whole life. So it's like, what about why the nose, So yeah, so thank you for saying that because I guess it's not easy to talk about, especially when you don't know who's listening. Right? It's easy for me to talk I'm sitting here talking to you, and we're just having this conversation. I'm like, "Oh, hey, and Rach, and this and that and the other," and when you reflect, well, people will take this information, and people will judge, and people will I have plenty of haters, I've said it before, I don't even know why. Like, I'm just a person, I'm just living my life, whatever, but, everyone's got their own agendas. But being able to kinda bring it out and when I say DM me, I mean DM me. I will answer you. I will answer you. I will help you because it is a passion of mine, and I don't want people to be misled in this great, amazing specialty of aesthetic medicine, plastic surgery, and there are very skilled operators out there who can help you, and there are also unskilled operators who will not help you and who will cause you to have subsequent operations that you probably then cannot afford. So just that it's a whole crazy train that we all get in. So thank you, Rach, for
Thanks,
listening.
Chris.
I
Yeah, thank
appreciate
you.
you going through this with me. And this is probably a topic that we'll bring up again because we didn't even get to touch on just beauty as a concept, like what is grateful, not greedy beauty version? How do you support your daughters? How do you support your sons, you know, with other women, like how do we have that conversation so that is not the driver because as I've said, I'm a whole person. I'm developing every aspect of my life. This is one thing that I do among many things that I do to optimize myself as a person. So, it's just important for people to understand a whole big picture. So, with that, Rachel, this has been
Chris.
lovely. Thank you so much. And this has been, is, and forever will be the I want to say something else, but I'm not going to say it. The Grateful Not Greedy, Not Greedy, Grateful Not Greedy podcast. And aloha, Rach. This was really fun.
Aloha, Kris.